Hello, my name is Aurora, and I will be discussing chapter 7, which was determining the function of behavior. And I really did enjoy this chapter. I work in early intervention, so I am constantly supporting families from birth to 3, and this chapter really connected to what I do every day. The things that I've seen in this field. So I do appreciate how this chapter was able to break a lot of these things down, and also put emphasis on us getting to the why before we jump to the solutions. So there are 3 things that I did learn from this chapter, and the first one was all behaviors have a function. One of the biggest takeaways from this chapter was learning that behavior doesn't just happen, doesn't just come out of nowhere. It's always trying to communicate something, which we learned that is the AVC, the antecedent, the behavior, and the consequence. So before the behavior is the antecedent, which is the reason why the behavior is happening, right? But we don't jump to the conclusion of why. We're trying to figure out what caused the behavior to happen. So in early intervention, I work with so many little kids who do not verbally communicate. So instead of them verbally communicate, the communication is through their behavior. So an example that I have is a toddler that I see throws and hits and bangs their head because they cannot verbally communicate what it is that they need, what they don't need, what they don't want. So after observing that behavior and talking with the family and trying to figure out what is wrong, we realized that maybe the child has way too many options. Maybe the child is overstimulated and overwhelmed and did not know how to ask for help. So they got attention to see what was wrong by the negative behavior. So that function was them escaping, right? Because the child was trying to avoid the stress of the transition. Didn't know how to communicate it though. The second thing is behavior support plans are built on good observation. I just talked about this, so this chapter really put emphasis on how to collect data, the importance of collecting data, and things such as the AVC, which is the antecedent, behavior, and the consequence. By using those charts in interviews and figuring out what is triggering the behavior and what keeps it going. I don't have to formally use that every day, but I believe using that is really great to identify the behavior, right? So we have kids, and we don't have typically behavior goals, but we have children who may have behavior going on because of lack of communication, like I stated before. So this little girl that I work with, that I stay at the daycare, she likes to hit, she likes to throw when she's overstimulated. Of course, she cannot communicate that she may be overstimulated or something is wrong, right? So I decided, well, let's try to figure out what may be the problem, and let's maybe incorporate some picture cards because the child is unable to verbally communicate what is wrong. So I introduced the picture cards to the family, coached them on how to use it, kind of put some of her favorite things on there. So maybe she can point to what she wants and use those as options. Also show the daycare teachers that as well. So once I got that, we started using that helped decrease that behavior. And so it helped her try to communicate, so we don't have to see the negative behavior as much. So I loved how the chapter did emphasize this proactive mindset. A couple of questions that I have. The first question is, have you ever been involved in an FBA or something familiar or similar where you were part of figuring out the why behind the child's behavior? And if so, what did that process look like when you were figuring that why out? The second question is, in your setting, do you find it easier to recognize escape motivated or attention seeking behaviors? For me, escape behaviors in toddlers usually is easier to spot more than attention seeking behaviors. Those can be kind of tricky, especially when the adults are trying to give in, right? There is a pushback that I have when reading this chapter, and that was about the brief functional analysis. I do believe that it is a great theory. However, it's kind of hard to do that and use that theory, especially in what I do every day in early intervention. That theory doesn't feel realistic because we're not in a clinical setting. We're in a natural environment, which will be the child's home or daycare. And even in the home and even in daycare, there are families and daycare teachers that are juggling so much, so it's just not realistic to use that theory. So instead, it's more informal. So we observe the routines and we talk to the caregivers about what they see every day, what is going on every day and within their routines. So I kind of do wish that the chapter gave more examples on how to adapt functional assessment strategies, especially in the early childhood settings. I did really enjoy this chapter because I really do enjoy talking about the behaviors and why the behaviors are happening. But this chapter also, it was important to me because it helped me to understand how to slow down and figure out what the child is trying to tell us through their behavior. It's not always easy figuring it out or dealing with multiple needs, but when we understand the function, we can support the child in a meaningful, positive way. So thank you for listening to me as I discuss chapter 7, determining the function of behavior.